My talk today is going to be on the back table and how our back table is tremendously important for all that we do. I think just let's go ahead and I'd like to start thanking the organizers for this interesting symposium. It's an unusual topic to talk on a Sunday morning. OR ergonomics, OT lights, autoclaving. I think none of us are really taught these things in the course per se, and it's really interesting to have to talk about this because you have to talk about it, you have to go through with some literature and find out more about this. So thank you once again, Dr. Chanda, for giving me this opportunity. Every time he asks me to talk on a particular thing, I find I'm richer at the end of the whole thing because I have to read to do this stuff. But so what's new really about this topic? I guess nothing. There's absolutely nothing new about this. But I'm a big fan of Atul Gawande, and I just keep on wondering as to whether we can do better and better. It's a wonderful book. Any of you who have not read it, you must pick up this book and read it. Atul Gawande has written a couple of really great books on the Checklist Manifesto and Complications and Better. And this is basically an attempt to try and get better at whatever it is that we are doing on a regular basis. There comes in a time in your life when you have to decide that probably what is the scariest part of your entire practice is to accept mediocrity. And if you find yourself not being able to accept mediocrity and you want to raise the bar a little bit, you are going to have to think of these smaller things because these small things in life that are only going to make it big. So when I start talking about trolley, this is what I think of, that having a clear mind and a clear space allows you to think and act with purpose. Finally, you really don't want to spend your time in the operating theater. You want to spend it maximally on getting a reduction, getting the implant in place, and you don't really want to spend your time in figuring out where I have kept the drill key, where I have kept my hay grooves, reduction forceps, and stuff like that. So to break up this talk, I'll be talking just a little bit about how to drape the trolley, how to arrange the trolley, tips and tricks to make life easy, and how to dispose the instruments. And as this is a very, very small talk, I think we can catch up with some lost time that we have a little earlier. So how to drape the trolley is, I think, a straightforward thing. You have to use an impervious sheet as a primary cover. Use a waterproof sheet if it's easily possible. Make sure that all the edges are really well covered. It's really horrifying to see one of the posts of the trolley, kind of showing itself halfway through the surgery, and then you're not really sure as to whether your assistant or your nurse has touched it or something. Uh, what I find, especially in smaller nursing homes, is there seems to be maybe one or two trolleys only, and you have to try and fit all your instruments into one, which is really a ridiculous way to do this whole thing. You should be having an adequate number of trolleys to work on this. So I like to cover the trolley by 360 degrees. All four corners should be adequately covered and adequately overlapped so that there is no question of any part of the trolley being left naked. You really don't want to see steel halfway through your surgery, and if you cover it by an impervious sheet, you can do that. There are some commercially available sheets which are also available, which have got a plastic at the bottom and a kind of a patient pad or a soaking pad on the top. But I can almost see some smaller surgeons, smaller place surgeons saying, "I can't use that for all my patients." That's your look. So an impervious sheet will pretty much make sure that whatever is there below on the trolley surface, even if it has been cleaned and it has been sterilized, you are still completely sterile. It's a good idea to cover the impervious sheet again and then start going around laying on your entire trolley. My focus has always been on trying to pick up newer stuff, and we must simply take up and adapt and adopt stuff from other industries. And one thing that comes to my mind is the Kanban process. The Kanban process is something which was defined by the Toyota people, and it is called as the just-in-time philosophy. So it is not really necessary to have everything on table at the beginning of the operating of the operation. You may want to, this is the bad part of the Kanban theory is that when you start a surgery, you may not have your implants on the table already open. But if you're keeping them closed and autoclave for a longer period, perhaps we can hold on to the sterility a little longer. Coming back a little later to Kanban process, what you need to make sure pretty much is that everything is already laid out. There are very few things that are differently needed every day. So you need a fixed number of gloves, you need a fixed number of blades, you need a syringe to take a sample, you need I would like to mention here that all your linen has to be completely labeled separately. So you have separate packs and you can decide and open as much as you need. You don't need to open up every damn thing in the operating theater. You can use and open what you need. If you have a pre-operative layout, a little better kept this than this, you probably know what you're going to need and you can open it as and when it is required. So arranging the trolley is pretty straightforward. You need to make sure that the sharp instruments are either kept under a towel or in a kidney tray. Some people like to keep the sharp instruments, including knives, scalpels, under a towel so that even if you by chance touch the trolley, it will not hurt you. However, the flip side to this is that obviously you can't see the scalpel under the towel, and so can still hurt yourself. Keeping it in the kidney tray is, I think, the standard format. I like to use one third of the trolley for general instruments. Two-thirds of the trolley should be for the other instruments. I like to use a completely second trolley for implants. I do not use a Mayo trolley myself because I find it a little unstable. Even if it is kept over, if you kind of keep a heavy implant box on it, it tends to tip over, and you really don't want your implants falling down halfway through your surgery. When I'm using reamers, I like to get my staff to arrange them in an increasing order, or I like to color code them so that, sometimes it's very difficult to read the reamer numbers. So if you're color coding them, then you're probably sure. Like Vibgyor is what I normally use for my cases. One of my, as Dr. Tanna said very, very correctly and very interestingly, it's not only you who are important in this planning process. I remember this ward boy of mine who said, "Sir, why don't we pack the dressing material separately and open it only at the time of the dressing, for the simple reason that it tends to get soaked halfway through your surgery if it's on your trolley. You tend to spill saline onto it, tend to spill betadine onto it, and you really don't want to have a messy looking dressing at the end of the thing. So I keep my dressing material packed separately. Before arranging the trolley, what's really important is to check the indicator strip. So each of my materials that I use during the surgery has an indicator strip, and it goes onto the register in the OR, so that we have a documentation. We do not have an NABH hospital, but we do have documentation definitely that this particular surgery's linen was autoclaved, its implants were autoclaved, its drum was autoclaved, instruments were autoclaved, the spinal tray was autoclaved, the scrubbing tray was autoclaved, and the dressing pack was also autoclaved. So these 7 columns which are get filled by the marker, so that you are kind of documenting that it has been done. It's worthwhile checking the expiry of autoclaving. In my clinic, we make sure that we autoclave one night before. So usually this does not happen, and maybe in larger hospitals this could happen where you're opening up trays which have been autoclaved previously 2 days or 3 days before. When you keep the instruments on the back trolley, as Sir said, everyone's got his own peculiar style of keeping the instruments, and this is what tends to happen. You kind of pile them on everywhere, and you're not really sure what is happening where and what's going on where. A large number of us would keep the drapes on one side of the trolley, the gowns on one side of the trolley, the kidney tray there, and the katori has got the gauze pieces for the cuta. This was taught to me by one of the ward boys here. I would like to bring attention to you here that you can either just spread them all out, or you keep all your friends together. So what that means is the two plate holding forceps go on together, the osteotomes go back together. We don't reuse the gloves, but yes, we cut them up and make them into rubber bands and use them to hold the instruments together. And so that those of the ones which are not required, they can just be washed immediately without a problem. I would like to bring to your attention this problem of the K-wire holders and the bender kind of bound together, so that it really never happens that you will have the K-wires in place, but you will not have a bender on your table. So keeping friends together is perhaps a good idea, perhaps. A couple of tips and tricks. As I said, I like to keep instruments which are tend to get lost in well-known places. For example, invariably the drill key has a peculiar habit of disappearing halfway through the surgery. It kind of goes and hides in between the instruments, or hides below the implants, or goes and hides in the box. So what we do is we have this particular place for the drill key. It's in a katori in the corner on the right hand side, so that whenever I use a drill key, it goes back into its own container, so that whenever I need it back again, I can hunt it out again. I really hate having a scrub nurse or a ward boy trying to point out कि ये यहाँ पे है पड़ा हुआ. So we use a laser pointer, and I need to thank Dr. Alankar Ramteke who gave us this brilliant idea. I thought it's a good idea to use a laser pointer during surgery for the person to show कि ये यहाँ पे पड़ा है उसके अंदर. So as I said, group your instruments well. So those that are required for suturing, they go together. That means a tooth forceps, a needle holder, they're kind of wrapped together, so that pack is open during the surgical process of doing it together. We recently moved to keeping stuff in trays. This is a complete full tray. You have this wire mesh trays as well. It makes it a little easier, and probably at the end of the surgery, the end point, you still land up making sure that everything looks fairly good. The katori also, or the bowl, collects whatever suture material that we have used, so that it is easier for the person to document it post-op, and you don't really have to have someone rifle through the contents of your waste paper bins to find out what suture material will use. Invariably, we all tend to use the same suture materials more often, so it's not a big problem really. As I said, this is all about the Kaizen process. I'm a big fan of the Japanese. The book on lean management by Toyota is an amazing book, and it's finally you have to try to change your methods, making small changes and overcoming resistance to change in very small ways will make your life a little more easier. This is on the right hand side, what is called a simple Kanban board is something a little expansion of what I have learned once from Dr. Chandak. So if he's got to remove an implant, I remember seeing him removing the implant and then telling the anesthetist, okay, the implant is out. Okay, the reaming is done. Okay, the new nail is in place. Okay, the distal lock is in place. Now, what this particularly does is it informs the entire team throughout the surgery. Okay, there were 6 steps of the surgery. Of the 6 steps, 4 are done, 2 are still remaining. And in case someone has forgotten, if I have forgotten to remove a K-wire, you have still that line pending there. We have a Kanban board inside my operating theater. So closing down the operating theater, if all has gone well, your trolley will still look perhaps like what it was when you started. It's a good idea to open all instruments before washing them. Invariably, everyone keeps the artery forceps closed for setting it for washing. Washing reamers and drill bits carefully is a good idea. I remember having been taught by Dr. Ajit Damle from Pune, who would wash his drill bits and osteotomes on his own and then cover them with soft rubber tips just to make sure that the edges were kept really sharp. So as I said, there's nothing new about laying out an OT table or an OT back table, but I just thought that these are some things I picked up on the way and I would like to share them with you. Thank you so much for your time.